What if the position you choose tonight determines whether your brain gets the protection it needs by morning? Emerging research suggests exactly that. Almost 1 in 3 strokes happens during sleep or in the first few hours after waking, during a period when your body should be healing itself. These events don't always follow dietary mistakes, skipped medications, or moments of acute stress. They frequently correlate with nighttime physiology and body positioning that alters circulation, pressure dynamics, and oxygen distribution. This discussion explores how everyday sleep decisions can elevate or reduce risk during the night, particularly beyond age 60, and why subtle changes before bed can prove more consequential than most people understand. Most assume strokes appear without warning, sparked by sudden pressure or random misfortune. That understanding is incomplete. Risk doesn't only climb during waking hours. It quietly intensifies at night when circulation decelerates and blood composition shifts. After middle age, blood becomes more viscous during sleep. Pressure can swing with positional changes, and oxygen levels may decline without your awareness. That means the hours you consider safest can actually represent your most vulnerable period. If you believe sleep is a neutral reset, or that nothing consequential occurs while you're unconscious, that assumption deserves scrutiny. What unfolds at night doesn't stay contained there. It can determine how your brain awakens. I'm Dr. Mehmet Oz, and over my career, I've examined thousands of cardiovascular cases. What consistently surprises people is how much nighttime patterns influence daytime outcomes. Not long ago, I encountered a man in his late 60s who appeared to be managing everything correctly. He exercised regularly, monitored his diet carefully, and his lab work showed nothing alarming. One morning, within minutes of waking, he abruptly lost strength on his left side, and his speech became garbled. There had been no warning signs the previous evening, no discomfort, no obvious precipitating event. When we analyzed his case, the conventional risk factors didn't account for the timing. What emerged instead were patterns during his sleep, how his body was oriented, how his breathing altered, and what occurred with his circulation throughout the night. That's when it became evident the problem didn't originate that morning. It began hours earlier, while he slept. Here's why this matters profoundly. During sleep, your body isn't dormant. It transitions into a different operational mode. Heart rate decreases, respiratory patterns modify, and blood redistributes according to gravity and posture. In younger individuals, blood vessels adjust effortlessly. With aging, vessel walls lose flexibility, and the brain becomes less forgiving of pressure fluctuations and oxygen variations. Particular sleep positions can elevate pressure within the skull, restrict venous return to the heart, or subtly diminish oxygen reaching sensitive brain tissue. These alterations are typically silent. You don't sense them occurring. Yet across several hours they can strain vulnerable vessels or destabilize existing arterial deposits. By morning, the injury may already be established long before you take your first steps. What makes this especially troubling is how prevalent these nighttime conditions are and how infrequently they're acknowledged. Many people beyond 60 retire to bed, assuming that once they fall asleep, their body will automatically safeguard itself until dawn. But during nighttime hours, blood exhibits greater clotting tendency. Blood pressure can surge with minor position changes, and oxygen dips may persist undetected for hours. Combine that with fragile vessels or constricted arteries, and the safety margin becomes remarkably narrow. This explains why so many strokes are discovered upon waking, not during physical activity. It isn't that something suddenly malfunctioned in the morning, it's that silent stress accumulated during rest until one small shift exceeded the threshold. This doesn't imply sleep itself is hazardous, and it doesn't suggest everyone faces identical risk levels. The issue isn't rest. It's the hidden patterns that shape what's occurring inside your body while you rest. Before discussing solutions, it's essential to understand where genuine risks originate. Some are so commonplace that people assume they're benign. In fact, one of the most widespread sleep habits among older adults is also one of the most overlooked risk amplifiers. Before identifying that habit, pause and consider how you typically fall asleep. Not the environment, not the mattress, the exact position your body assumes when lights go out. Most never question it because it feels natural and comfortable. But comfort doesn't necessarily equal safety. One particular position is widely perceived as healthy, even recommended by well-meaning friends and relatives. Yet for many older adults, it quietly establishes the conditions we just discussed. When you lie down, gravity immediately transforms how blood circulates through your system. The heart, brain, and lungs all respond to that shift. If the head and neck are positioned in ways that impede venous return, blood can pool inappropriately. Simultaneously, oxygen delivery may become less efficient, especially if breathing subtly constricts during sleep. Over extended hours, this combination can increase pressure inside the skull and stress delicate vessels already weakened by age. None of this produces pain, so your body doesn't transmit warning signals. It simply adapts minute by minute. The hazard emerges from duration. What seems insignificant for minutes becomes substantial after an entire night in the same orientation. Here's how this typically manifests without drama. Following a night of sustained pressure or diminished oxygen delivery, some notice subtle morning effects: a sense of head fullness that eases after sitting upright, brief lightheadedness when standing, or vision that requires minutes to feel completely clear. These aren't emergencies, and they don't indicate a stroke has occurred. They reflect temporary circulation and pressure shifts that resolve once gravity and breathing normalize. The concern isn't a single morning like this, it's repetition. When identical physiological stress happens night after night, the brain's small vessels are repeatedly challenged, potentially increasing vulnerability over time without generating obvious warnings. This is why sleep-related risk often goes unrecognized. Nothing dramatic occurs in the moment, and the body appears to recover once you're upright and mobile. That temporary relief can mislead. Overnight physiology doesn't reset instantaneously. It leaves small traces that accumulate with repetition. When circulation, pressure, or oxygen delivery face challenges for hours continuously, the brain adapts until it cannot. Understanding this pattern transforms sleep from something passive into something active and influential. Now, let's address the first specific habit creating this overnight stress. It's one many believe is healthy, even protective. Some are advised it benefits posture. Others assume it maintains spinal neutrality and relaxation. In reality, for numerous adults beyond 60, this habit accomplishes the opposite of expectations. It modifies pressure dynamics in the head and neck during sleep and can quietly interfere with blood return from the brain. Because it feels comfortable and familiar, it's rarely questioned. But comfort alone isn't a reliable indicator of subsurface processes during sleep. Sleeping completely flat on your back with minimal or no head support alters how gravity influences blood flow overnight. When the head is level with or slightly below the heart, venous blood returning from the brain can decelerate. In younger bodies, vessels compensate readily. With age, that adaptability diminishes. The outcome can be gradual pressure elevation within the skull and reduced oxygen delivery efficiency during long, uninterrupted periods. This position can also exacerbate subtle breathing restrictions many don't realize they have, further lowering oxygen levels during sleep. None of this feels dramatic while happening. The body simply adjusts, but across hours, the combination of pressure and reduced clearance places extra strain on fragile cerebral vessels. What makes this position particularly hazardous is how easily its effects compound through the night. A small pressure increase or mild oxygen drop alone usually isn't dangerous. The problem is duration. Remaining in the same flat position for 6, 7, or 8 hours means those conditions persist without relief. Over time, this can stress tiny vessels deep in the brain already vulnerable with age or hypertension. It can also interfere with the brain's waste clearance during sleep, allowing metabolic byproducts to linger longer than optimal. At this point, many ask a reasonable question. If sleeping flat creates these conditions, does that mean back sleeping itself is dangerous? The answer isn't simple yes or no. Position alone isn't the complete story. What matters most isn't whether you're on your back, but how your head and upper body are positioned relative to your heart. A completely flat posture removes gravitational assistance for blood to drain from the brain. That's the key issue. Small elevation changes the dynamics entirely. When the upper body is gently raised, pressure inside the skull can ease, and breathing often stabilizes. This is why some feel better simply by adjusting pillow height, even without changing sleep position. The second habit that often creates overnight strain relates to which side you sleep on. For many, this choice feels completely neutral. Most adults settle into a side position without consideration, but anatomy makes side sleeping asymmetric. The heart isn't centered, and major vessels returning blood to it aren't evenly positioned. Consequently, one side can subtly alter how hard the heart must work during the night. For people with existing cardiovascular stress, this difference isn't trivial. When you lie on your right side, body weight and organ placement shift in ways that can affect blood return to the heart. One of the largest veins carrying blood back upward runs along the right side of the spine. Sustained pressure in this position can slightly reduce that return, requiring the heart to work harder maintaining circulation. Simultaneously, the heart itself sits slightly left of center. Right side sleeping can limit its natural movement, especially during deeper sleep stages when muscle tone reduces. In healthy younger adults, this difference is usually insignificant. With age, or when heart function is already strained, these small mechanical disadvantages can matter more over several hours. From a physiological standpoint, this appears as subtle nighttime effects rather than obvious symptoms. Circulation may become less efficient, heart rhythm variability can increase, and oxygen delivery may fluctuate more than usual. These changes often remain invisible to the sleeper and resolve once position changes or morning movement begins. The concern is persistence. Spending most of the night in a position adding workload to an already stressed heart can amplify existing vulnerabilities over time. Another common habit increases overnight risk differently. It's often adopted for comfort, especially by people attempting to relieve reflux, congestion, or shoulder pain. The intention is sound, but execution can quietly backfire. This habit involves how much support is placed under the head and neck during sleep. Too little support can strain circulation. Too much can do the same in a different direction. The issue isn't the pillow itself, it's alignment. Over-elevating the head by stacking multiple pillows bends the neck forward and compresses structures along the cervical spine. This can partially restrict arteries supplying critical brain areas, including regions involved in balance and autonomic control. It also creates muscle tension persisting through the night, increasing resistance to normal blood flow. These effects are rarely dramatic, which is why the habit persists. People wake up sore or stiff and assume it's age or stress. But repeated nights of poor alignment can gradually contribute to headaches, dizziness upon waking, or pressure that resolves only after movement. Proper head and neck support maintains the spine in a neutral line while allowing gentle elevation of the upper body if needed. This means the chin isn't pushed toward the chest and the neck isn't left unsupported. A single well-shaped pillow that fills the natural neck curve often accomplishes this better than multiple stacked pillows. When elevation is necessary for breathing or reflux, raising the upper torso evenly preserves alignment and keeps blood flow unobstructed. There's one more nighttime habit that operates differently but can be equally influential. Unlike posture, it doesn't involve the spine or neck at all. Instead, it changes how blood is distributed throughout the body right before sleep begins. Many consider it harmless, even relaxing. But in older adults, this routine can quietly destabilize nighttime circulation and pressure in ways that only manifest hours later. Going to bed immediately after a heavy meal or alcohol consumption is among the most underestimated contributors to overnight vascular stress. Digestion demands blood flow, redirecting circulation toward the stomach and intestines. Alcohol adds another layer by temporarily relaxing blood vessels. Together and close to bedtime, they can create unstable shifts in blood pressure and flow during the night. For bodies with already narrowed arteries or reduced adaptability, these swings matter significantly. When digestion and sleep overlap, blood supply divides between competing systems. The brain relies on steady flow during sleep to regulate pressure and clear waste. Alcohol further complicates this by initially lowering blood pressure, followed by compensatory increases as the body attempts stabilization. These fluctuations can stress vessel walls and disrupt normal nighttime regulation. Because this occurs while you're asleep, there's no awareness of the strain. The result may be fragmented sleep, morning fog, or a racing heart upon waking. Spacing dinner and alcohol well before bedtime gives the body time to rebalance circulation before sleep begins. Light movement after eating helps normalize blood flow and supports digestion without strain. These small timing changes don't require sacrificing anything. They simply reduce overlap between systems competing for circulation. Now that we've covered habits that quietly increase risk, it's time to shift focus. Avoiding strain is only partial protection. Certain sleep positions actively support circulation, breathing, and nighttime recovery. These positions don't require perfection or special equipment. They work by cooperating with anatomy rather than opposing it. Sleeping on the left side or on the back with gentle upper body elevation tends to support nighttime circulation most effectively for many older adults. These positions reduce unnecessary pressure on major vessels, promote steadier blood return to the heart, and support more consistent oxygen delivery. They also align with how the brain clears waste during deep sleep. The key isn't forcing yourself into discomfort. It's making small, informed adjustments and observing how your body responds. Sleep isn't passive. It's an active physiological state that shapes how you wake up. When you respect that process, even modest changes can support long-term brain and heart health far more than people realize. The hours you spend unconscious aren't neutral time. They're when your body performs its most critical repair work, and the conditions you create for that work determine whether you wake up protected or vulnerable. Choose positions that work with your body, not against it, and you give yourself the best chance of waking up strong, clear, and ready for whatever the day brings.